Good afternoon, everybody, and welcome to another Lunch and Learn. And I am delighted to be here together with Barcelona Crew Academy and with Joanna. Hi, Jojo.
Hi, Ono.
Hi,
Hi, Mayte.
Hi.
And so I see we've got a lot of people here already. We got like people from Jeddah, from Mallorca. Mayte, you're in Barcelona, right?
Yes, we are in Barcelona Crew Academy in the offices where we do the trainings.
Fantastic. And we're delighted to have you back with us. Thank you so much for doing this. And thank you, everybody, for attending. As always, we are recording this webinar so you can look it back, but please feel free to ask any questions in the chat. And as we're talking about a very serious topic, any tips you have, you can also share, because I think we all want to learn from each other. But let's get started with like what we're trying to do today. So today we're going to talk in this Lunch and Learn about the COVID tips and advice for interior service and housekeeping. That's the key element of today. And we obviously all know that COVID probably is not going away. So these tips are there to stay. So the basic knowledge, advice for housekeeping, and advice for laundry and guest service procedures. Obviously, we are not the specialists, Barcelona Crew Academy is. So we're doing that together with Mayte. And Mayte is the training development manager of the Barcelona Crew Academy. And we're doing that with Nuria, who is the food and safety and hygiene auditor. So she is the knowledgeable person. She knows everything about the safety and hygiene on board. She's a certified auditor, so she's going to make sure that we get the right information. So, COVID tips and advice for interior service and housekeeping. As I said, basic knowledge, advice for housekeeping and cleaning, and advice for laundry and guest service procedures. But without much further ado, Mayte, I'm going to give the stage to you. You probably want to introduce Barcelona Crew Academy shortly, and then we go straight into the training. And as always, please feel free to ask any questions in the chat. We are also very looking forward to your own tips, the things that you've experienced that work or do not work. And as well, we hope you're safe, and we hope that you are on a vessel, which means that we're almost getting back to normal. Mayte, it's all yours.
Hi, everybody. Thank you for coming today to this webinar. We are Barcelona Crew Academy. We're based in Barcelona, in Marina Port Bay, and we also have offices in the center of Barcelona for training. We are guest program providers of interior training for the yachts, for the super yachts. Today we are going to provide you a small webinar that we have prepared with Nuria. Nuria is a teacher of food safety level 2 and level 3, and also is food hygiene auditor and SSCP auditor. And yes, we have prepared this with UK requirements for regarding hospitality and regarding risk assessment for hospitality business and food handlers and everything. You have the reference at the end of the presentation. And I will leave now you with Nuria, and I hope you enjoy the training.
Well, good afternoon. I'm going to introduce myself. I'm Nuria Montella. I'm a veterinary surgeon, a specialist in food hygiene and food safety. And as Mayte was explaining, this is based on the latest UK guidance that they will be on the last page of the presentation. But remind keeping yourself updated on these official web pages. Okay. So let's start the presentation. Okay, yes, we're starting now. So this will be the webinar of today. The subject of the webinar is some tips for the hospitality industry for housekeeping and service. Okay, this is our index for today, explaining a bit about COVID facts, how is the roots of transmission of this disease, the relation with coronavirus and food, advice for the crew working in kitchens, advice for food service staff, how to put our face coverings, food hygiene guidance that are recommended to use during COVID, how we are going to handle the operations on food unpacking, the cleaning operations, then cleaning operations in case we have a positive, somebody that is positive and has got an infection, how we handle laundry, the waste, managing employee sickness, and other additional considerations. Okay, first of all, I'm sure you all know, but just to summarize a little bit, COVID-19 is from the family of the coronavirus, a very contagious respiratory illness that has caused many infections and death worldwide. The only thing is that we know about coronavirus, but this is a new disease and has been transmitted from animal to humans, but we're still learning about it, because it is very new, okay? So check government websites for regular guidance. Just to explain a bit the difference, viruses are smaller than bacteria, and bacteria multiply on surfaces. But viruses will not multiply on the surfaces. They need a host to reproduce. They need cells, but they can stay alive on surfaces. That will be very important in the whole of our presentation. By average, we assume that if somebody has contaminated a surface, that virus could remain active 72 hours on the surface. That is an average time because it could be 24 hours in cardboard boxes, or maybe even 7 days in a stainless steel surface. So this 72 hours is an average that we have to work with. So it will be very important, the disinfection on surfaces, because yes, viruses will not multiply on these surfaces, but they are still alive on the surface. Okay, so what do we have as a symptoms for this COVID-19? We can have fever, tiredness, a dry cough. Some patients may have aches and pains, nasal congestion, runny nose, or sore throat. These are some of the symptoms. Doesn't mean you can have them all. Sometimes they present some of the symptoms or others, okay? And they could be, they start being mild, and they could begin gradually. One of the challenges of coronavirus is that the people may appear well, and they could be carrying the coronavirus and being in the incubation period, which is considered from 14 days. But in this incubation period, they could be spreading the virus before they show any symptoms. But then there are other people that they will never show the symptoms. They are what they call asymptomatic carriers. That is very, the population that they are normally asymptomatic carriers are children and young adults, but also some adults are asymptomatic carriers. They remain asymptomatic and they don't show symptoms, but they could be transmitters of the disease. I think these last 2 points is what makes the disease difficult to control. This incubation period of 14 days without showing symptoms, or people that do not show any symptoms at all. So it is very difficult to control it. But on the good news, I'll just go back to the first slide. We know that this virus can be easily killed with the normal use of disinfectants. So they do not present resistance to the disinfectants. So that's very good news, and is a very good way to control it as well, by disinfecting the surfaces, for example. Okay? So what are the routes of transmission of the disease? The disease will transmit by face, eyes, nose, mainly from droplets spraying by an infected person to another person who is in close proximity. This is because the social distance of 2 meters is so important, because the droplets will infect a healthy person from a diseased one. Okay, so what are the routes of contamination? One is the droplets, as we say, from when we sneeze or cough, and the sneeze and cough from this infecting person lands on surfaces, and then these surfaces are touched by hands, and these hands we use them to touch our eyes, nose, and mouth. Okay. Yes. The other via of transmission is by contaminated hands, by an infected person touching our hands by means of handshake. So we have to avoid any contact, personal contact. We have to keep it to the bare minimum and not give handshakes or any physical contact with the people. Okay. Also, hand contact, touching doors, push buttons, and then we are touching these surfaces and touching our eyes, nose, and mouth. So try to keep the hands clean and disinfected at all times, and keep it on the waist down. If you have dirty hands, avoid touching your face, eyes, and nose, because until you can wash your hands and disinfect your hands. That's a good rule to think, to keep the hands on the waist down. Another possible way of transmitting is somebody touching the face and then going into the hands and touching surfaces. So by summarizing this slide, the most ways of preventing the transmission will be the social distance of 2 meters, washing constantly and disinfecting hands, and obviously the good practice of sneezing and coughing on the crotch of your arm, or using a disposable paper tissue and disposing of it immediately in a waste bin with a lid. That could be another way of if somebody has to sneeze or cough. Okay, so keep the good practice, keep the social distance, do not touch your face, eyes, and nose and mouth with dirty hands, and keep cleaning your hands and disinfecting your hands to avoid the transmission. Okay. Yes, this virus is very similar to other respiratory viruses that we already have, like the flu, cold viruses. Basically, we have to apply good hygiene. Good hygiene, we all know, because we work in a kitchen or service, so we know how to keep good hygiene. And in this case, good hygiene is very convenient because it will help us to avoid the transmission of this disease. Okay, because we know by washing hands and disinfecting surfaces that will lower down the risk of transmission. Okay. Every business has to carry out what we call COVID-19 assessment and have it on display. That will be, you will have to arrange on your boats what are your precautionary measures for avoiding COVID-19. And these precautionary measures will be displayed in notices around the boat for guests to see and for all the rest of the crew to see and be constantly reminded. So first of all, in the boat, you will have to establish your preventive measures, social distance, washing hands, disinfect hands, and display these measures in notice boards in several places in the boat. Okay. Also, very important, staff that have symptoms or are with somebody that shows symptoms should be not going to work or refraining from working. More sure, they will have to go into test to discard if they have the disease or not, and be going then, if they are positive, going then in isolation, away from the boat. If you are at sea, obviously you have to keep this person has to keep isolated until he gets to a port, and then continue the isolation elsewhere. We will talk later about some cleaning measures we can apply if we have a positive and we have to isolate them in the boat. Okay. Also, another precaution is washing hands at critical times and always keeping dirty hands away from your face. Okay. Yes, one of the other measures, we will increase the disinfection of hand contact surfaces in any public space. So we are used in food hygiene to apply disinfection, cleaning and disinfection. It's just, but now with COVID is highly increased the number of times, sorry about that, the number of times you have to apply the disinfectant on these surfaces. So that will be sanitized tables, chairs, doors, door handles, and any other touch point before and after movement of a staff or movement of guests. So before the guests arrive, you will sanitize tables, chairs, doors, door handles, any touch point. And after the guest has left the room, you will do the same. The same in the kitchen and the same where are members of the crew area. Yeah. We will keep the routine of disinfection this surface. It will be very high increase, the same as the routine of washing hands. So these two practice, we normally do it. It's just we have to increase the number of times that we do it now. Okay. Okay. Another good measure to prevent cross-contamination from possibly infected people is keep as much as possible social distance. If there are circumstances that maybe we cannot keep the 2 meters social distance, then we can use some techniques like keep washing hands and surface. The activity will remain as short as possible. Let's say you are doing the service. Perhaps during service, you cannot keep this 2 meters distance. You will try to do the service as short, as efficient and short as possible, and that will reduce the chance of contamination from a possible positive. Also, we can use when we are working with our colleagues, we can use back-to-back working techniques, or also work side to side. We are going to try the same as when we are serving. We are going to use side to side. We are going to try to avoid working face to face. Okay. Also, it has been proved being positive. Keep the crew staff in teams, fixed teams. So we will have perhaps the staff that works in the kitchen, that will be a team. Then the stewardess will be another team, housekeeping another team. So you keep in more close contact with this team of people. Yes. So if in case you have a problem, that will be reducing the chance of contaminating the whole crew. Okay, what do we know about coronavirus and food? We, as I said in the beginning, coronavirus is transmitted from an animal to a person, but it is not been proven that food can transmit coronavirus. So that is a very good news. Food is not a transmitter of coronavirus. But we know the virus can remain alive in contact surfaces. So we have to keep the precaution of disinfecting surfaces all the time, okay? And another thing could be food packaging. There is a section later on food packaging, how we will remove and disinfect any food packaging, just in case the virus could be still present on those surfaces, okay? Yes, any food handler that isn't well should not work. At the beginning of the presentation, we listed the symptoms. If you have symptoms, you have to communicate it. and follow any government advice, and not mix with the rest of the crew, and get in isolation as soon as possible. And if in your boat they could do the testing, you will be going to do the test and determine if you are positive if you have the coronavirus disease or not. But most important, if you feel like you have symptoms, for example, fever above 37, that could be a symptom, one of the most common symptoms. If you have a fever above 37, you have to notify it and go in isolation until you find out if you got the disease, or you can go off the boat in isolation. Okay, yes, we said the coronavirus is not likely to be transmitted through food, but we will keep washing hands with soap and water for at least 20 seconds. This is a very good practice, and especially when we are handling food, or we have been in a public place, or we touch our nose, or been coughing and sneezing. We have later on a list of occasions where we have to apply hand washing and disinfection. And keep a reminder that a hand washing has to be thorough, and it has to be performed at least minimum 20 seconds. To be a proper hand washing that is efficient. Okay. The crew staff in general have to follow the normal food hygiene guidance for preparing food that they have on the hazard plans, on the hazard training. So they have to, for food preparation, they have to also follow the good hygiene practice that they are currently following already. It's not hand washing and disinfection is not new to food handlers. They know about this practice. It's just the practice now is increased in times, frequency of times that you're washing hands. Now we are in the kitchens, working in the kitchens. We would like to be working in the kitchens, especially teams. So not allow in the kitchen teams from other parts of the boat. So, and in the kitchen, if it's people working, if they could keep the social distance, that would be advisable. But if not, remind yourself, work back to back or side to side, never front to front. So, use dedicated staff that will work in the kitchen. Also, in the storage areas like walk-in pantries, fridges and freezers, also limited the access to people, for example, to 1 or 2 persons, and that will help also to reduce the risk, okay? It is important that the crockery and cutlery are washed in the dishwasher, because the dishwasher will have higher temperatures, above 82. If this is not possible, you will have to do it in a detergent, very hot water, and then dry it thoroughly. In a separate tea towel. Use your dishcloth as normal to do the washing up, and then the rinse and drying, and putting it away immediately. During this crisis for COVID, it's very important the crockery and cutlery are not displayed, and as soon as they are washed, they are put away in the and safe, closed store until next time is going to be used. Okay. More advice for working in the kitchen will be kitchens, as the food hygiene practices that we already know have their regular cleaning regimes. But now for COVID, please increase the disinfection on touch surfaces. So use a sanitizer all the time. So when you are preparing food and you finish the preparation, keep disinfecting the food surfaces and also touching touching points like fridge handles, oven handles, and any other touching points. Also, in the boats, we will have food delivery coming to our boats. Then please minimize the contact with these people that are delivering food. They could keep the 2-meter distance, leaving the deliveries, and then you pick up the deliveries and go through the disinfection of the outer packaging or whatever is needed. We're going to talk later about the packaging, the food packaging. Okay, it is very recommendable. The chef should wear a mask and gloves when preparing high-risk foods. That will be the food that will not have a heat treatment. This will be the ready-to-eat food, like, for example, when preparing a salad, a sandwich, or when they are handling the food for serving. This food is not going to pass the heat treatment, because heat treatment will kill the virus, but obviously this food will not have this step of temperature. So please use mask and glove when preparing and handling these high-risk foods, okay, as a precaution. Okay, now we're going into the advice for food service. This is a very important moment because the crew that is doing the food service may come in contact with the guests. Okay, so whenever we have guests, the guests will have notices around the boat displaying the precautions about social distance, disinfecting the hands, use hand sanitizer, or washing and hand sanitizer. So when we have guests arriving on a surface area, we can remind them where they have hand washing units and where they can find hand sanitizer at the arrival before sitting for service. So also we will try to set up the guests in families together or even with their support bubble. What do we mean by this support bubble? A family of guests can have people that work regularly with them, like nannies or any personal assistant. This is people that are also in close contact with this family. So that will be a unit of guests. If this guest has invited people, or there is another unit of guests, another family, maybe we can put them in tables of 2 meters distance between groups of guests, okay? That could be an advice, but yes, you can keep together the guests from the same family or people that are working as a support bubble for these guests, okay? If you have a large group of guests, then you could stagger times for doing food service. So we don't have a high amount of guests at the same time on the breakfast or on the lunch service, for example. But that will be in the situation that it is a very large group of guests. That could be a solution. Work on a staggered times. Okay, when crew is serving the guests, we will keep the time as short as possible and use the side-to-side working techniques. Never face the guests, and the serving operations, keep it as short as possible. And this way we can reduce the risk as well. It is very recommended to use outdoor areas for eating because of the natural ventilation being beneficial for removing the risk of the virus staying onto closed rooms. So whenever possible, do the service in an outdoor area is recommended. More advice for food service, because as we said, this is a critical moment. Before I was talking about cutlery and crockery kept away All the tables, chairs will have to be disinfected before putting the service, putting the cutlery and the crockery, but that will be kept away in a clean, closed cupboard and only be put in displays at the moment of the service to reduce the chance of contaminating these utensils. Okay. Also, we have to limit the amount of things displayed on the tables. For example, a solution could be to use disposable condiments, but if we don't have or we not use disposable condiments, we can use cleaning non-disposable condiment containers that could be disinfected after every use. Okay. Using also disposable condiments is beneficial because the guests will not pass it from hand to hand, because they will take their own condiments and not sharing it with other guests. But that is important if you have a large amount of guests. But if not, clean non-disposable condiment containers after the service will have to be disinfected, the same as the tables, the tablecloth, the chairs, anything that the guests have touched. Okay. If we use tablecloth, we have to remove them carefully, not to spread the virus. Don't shake the liners of the tablecloth, so remove it carefully and put it directly into wash or into a dustbin bag with a tight knot until the moment of being washed. But don't leave the tablecloth lying around. Either put it immediately to wash or put it in a plastic bag until the moment of being washed. Okay. Yes. When the crew come in contact with items used by guests, then after they have to be washing their hands before going to another task. So when we finish the service, we will remove immediately the cutlery and crockery, put it to wash in the dishwasher, and we will wash and disinfect thoroughly our hands after we finish the service, ready for another job. Okay. Yes, it is compulsory to wear mask and to try to keep away as much as possible from the guest whenever possible. But yes, during the service, it is compulsory to wear mask during service. Okay, because we mentioned that we may be using face coverings in the kitchen, for example, when we are preparing the high-risk food, and also during food service, we are going to use face coverings. How are we going to handle these face coverings? So it is very important that you wash your hands thoroughly with soap and water and use hand sanitizer before putting the face covering and after you removing it. Okay, when you're wearing your face covering, avoid touching your face and avoid touching the face covering, because then you could contaminate your hands. If for whatever reason you have touched your face covering, you should be washing hands. Okay? If your face covering becomes very damp, you have to replace it and wear a clean one. Okay? So basically, it's wash hands before you touch your face covering. You put your face covering on. When the face covering is on, do not touch your face. And when you remove your face covering after your job, please bin them in the disposable, in the waste bins that will have lids, and clean your hands and disinfect them. Yes, change and wash your face covering daily. If it's one of these face coverings that can be washable. Okay, always use the instructions advice on the mask to see if whether they're washable or they are disposable. And keep practicing social distance whenever possible. Okay, food hygiene guidances. We know that we are currently applying food hygiene guidances and hazard plans. These hazard plans already talk about hand hygiene, cleaning of surfaces, cleaning and disinfection. So they're practices that they are known to us and we are very familiar with them. It's just with COVID, increase the frequency. So basically keep doing what you are doing, just increase frequencies and remind yourself about the touch points. Perhaps on these notice informations that you are going to put in displays for all the crew, you could put some tips of what touch points can be disinfected frequency, like door handles, rails, things that people are touching constantly, okay? So basically follow your food hygiene guidances, just increase the number of times that you clean your hands and you disinfect the surfaces. We said at the beginning that the virus will be killed by disinfectant. So keep applying the disinfectant on the surfaces. Yes, also, people have to remind themselves of the symptoms and be fit for work and wear their appropriate clean protective clothing. There will be a section on how to clean the protective clothing at the end of the day, but that should be changed daily. So that will be also a good way of preventing. Wear clean protective clothing. Yes, food hygiene guidances. Here you have some pictures on how to wash hands. Important that every sink has available warm water, liquid soap. Then you rub the hands for the 20 seconds, rinse your hands, dry them well, and at last, apply the disinfectant. One of the disinfectants that are recommended is the one with alcohol, at least 70% alcohol concentration. Okay, check the labels to ensure that the disinfectants that you are used are effective for viruses. Okay, and that you position these disinfectants in key places, for example, near the hand wash basin. We said before, when the guests are arriving during food service, they will have also hand washing units or at least disinfectants for facilitate the disinfection of hands. Okay, if they don't have any sink close. Okay, when you will have to wash hands? When you leave your cabin and you are ready to start work. And whenever time, yes, avoid touching surfaces. But if you touch any surfaces, you will have to keep cleaning hands. This is a list of instances where you are required to do hand washing. On leaving the cabin, on arriving, on starting the work, between any processes, on entering into the kitchen, after handling raw food, after clearing a table, after touching anything the guest may have contaminated, after touching hand contact surface, such as handrails, door handles, after using the toilets or going to toilet areas, after cleaning, after doing any laundry, after smoking or vaping breaks, after handling waste, after opening packaging or removing outer packaging of food, for example, after removing the gloves and putting clean gloves, and any time that you think your hands could be contaminated. So basically, keep washing hands, washing hands. That could save you from getting this disease that is a very serious disease that could cause a very severe illness, okay? washing hands at all distance. Okay. Other guidance, food hygiene guidance, is always tries to sniff and cough into a tissue and discard the tissue immediately into the waste bin. And if it's not possible, cough and sniff into the crook of your arm to minimize contamination. If you use a tissue, bin it immediately or flush down the toilet and don't leave it lying around on any surfaces. Wash your hands and use handheld sanitizer immediately afterwards. If anyone has a high temperature that will be above 37 or any of the COVID symptoms that we talked about in the beginning, like a cough, sore throat, tiredness, then they cannot start work. They have to notify it and at least self-isolate and find guidances on what to do in your boats. If you go to do the self-isolation, most possibly outside the boat. But if you're at sea, perhaps you have to do your self-isolating in your in the boat. Okay. Yes. If you have been with anyone that has shown symptoms, you also cannot work to work, and you also have to isolate until you find out by a test or if you have the disease or not. Okay. If somebody, or for example, if you've been in close contact of somebody that's test positive, you will have to go through the test to discard that you don't have the disease as well. Okay. We discussed before the food unpacking can be a critical moment. We said the virus will not multiply on surface, but they will stay alive. And the times that they can remain alive vary from 24 up to 7 days in a stainless steel. So it is very important. Let's have in mind in average they can be alive 3 days. So whenever we have deliveries, we will discard the outer packaging, any cardboard or plastic bags, discard the outer packaging and disinfect the packaging that cannot be discarded. And then you can store the food away in closed cabinets because it's already been disinfected, okay? But yes, follow your own risk assessment and take your precautions. Discard the packaging and disinfect what cannot be discarded. Because this packaging has been traveling, has been exposed in different areas, and it comes from outside, so it could be contaminated. Okay, now one of the most important sections of this webinar is cleaning and disinfection. Okay, if we are in the task of cleaning and disinfection, that is very important because with cleaning, we will reduce the risk of passing the infection. Normally, we will dress accordingly using disposable gloves, disposable aprons, and these should be put in double bags and discarded in the rubbish at the end of the cleaning. How are we going to do this cleaning? Normally, we will use first a cloth for the cleaning with warm water and detergent. Then we will rinse the surface and apply the disinfection. Okay, if it's in a small area, we could apply the disinfectant, alcohol 70%, or we could use also hypochlorite sodic 0.5%, or other recommended disinfectants that you may have. It's important that you read the label and make sure the disinfectant that you are using it is suitable for viruses. Okay, so the two-step cleaning disinfection is what's going to be most efficient. Cleaning with detergent, warm soapy water, then always remind not to apply the disinfectant with the same dishcloth that you have done the cleaning. So use a dishcloth for the washing and then rinsing, and then you can apply the disinfectant with another clean dishcloth or with disposable paper, for example. And if you're using dishcloths that they're not disposable, make sure that they're immediately put to the laundry or put in bags before they go into the laundry, but do not leave them lying around because they could they could be contaminated. Okay, especially the dishcloth that we use for the washing. Okay, so use separate cloths, if possible disposable, and apply first cleaning, then rinse, and then disinfection. There will be instances that we will not be able to apply the two-step cleaning and disinfection. Then you will have to apply a sanitizer, which is a combined cleaning and disinfectant at the same time. If, for example, in a door handle, that's what we call sanitizers or disinfectants. Door handles or handrails or work surfaces that we cannot apply the two steps, the cleaning of cleaning and disinfection. Okay, more on cleaning and disinfection. When we're cleaning and disinfecting, avoid creating splashes from the sprays, because that could splash back any viruses to us. Then, very important, the hygiene of the cloths and mops used for the cleaning and disinfection. Put them in waste bags and put them to the laundry immediately, or at least put them in a secure cloth bag. Okay? If, for example, we are trying to clean items that cannot be laundered, for example, furniture, mattress, steam is also a good way of cleaning and disinfection. That also, if we have an area that is contaminated with bodily fluids and it cannot be cleaned and washed, then perhaps we have to dispose of it. So, but we have to assess it at the time, okay? If it's something that is very heavily contaminated and it cannot be cleaned by using disinfectants and detergents, okay? But yeah, steam could be an alternative for upholstered furniture, for example. Seats, things like that, you cannot apply detergents and disinfectants. Okay, more on cleaning. If we have a positive or somebody that is suspect to have the disease, we will take extra precautions during the cleaning, and we will also put a mask. And yes, after it, we will clean our hands with soap and water thoroughly. But yes, if we think we are cleaning after a suspicious case, we will also clean with a mask, okay? And clean very well after we clean our hands very well after we touch, after we perform the cleaning, okay? Yes. Okay. These areas where this person may have been, if we have a possible symptomatic person, it is not so much a corridor or things like that. The person just has passed through. It is where the person has been more time or could have visible bodily fluids of this person, like bathrooms, door handles, telephone, grab rails, stairwells. So make sure you wear a glove, mask, disposable aprons to perform the cleaning on these occasions, just in case you have a positive or somebody showing the symptoms waiting for the results. Okay. Yes. Yes. Always when you finish washing, you have to do the hand washing and disinfecting of the hands, the same as after every operation. Okay. Yes, it is recommended to use disposable cloth, paper roll, or disposable mop heads to clean hard surfaces, floors, chairs, door handles, sanitary fittings. Okay, you can use disinfectant solutions, for example, made of chlorine or other disinfectants. Keep reading the labels. It has to be effective against viruses. As I said before, if you don't have disposable, please use a clean one every time, a clean and a disinfecting cloth every time, and use separate cloths for cleaning and for disinfection, and put it immediately to laundry or into a bag ready for laundry. Okay, this is a bit of the same recommendations before. Avoid creating a splash. Use a steam if things cannot be cleaned and disinfected. If you have a piece of furniture with upholstered furniture that cannot be cleaned and disinfected. Steam is a good way of killing the virus as well, because they cannot stand temperature. Okay. Now, our uniforms. Our uniforms will protect the food and other guests from our personal clothing. So it is important that uniforms are changed every day and are clean, and they are removed at the end of the day and put to the laundry immediately. If we don't have this possibility, we have to keep them in close bag. We said we should not shake the clothing, okay? So we don't spray the viruses. At what temperatures are recommended to do the wash? Obviously, if you can do 90 degrees, 30 minutes, that will be the most higher temperature. But sometimes the equipment or the uniforms cannot stand such a temperature. So at least, yes, at least we will use 65 degrees with detergents, sanitizers that will help also to do these disinfection steps. They are recommended brands, especially special brands. I will show you a picture later, that can be used for doing the laundry, and they will act also as a disinfectant. And in these cases, 65 degrees could be also acceptable, because we have in the help of the sanitizing agents of the laundry powders. Okay, if high temperatures are not possible, or we cannot clean the uniforms immediately for whatever reason, a solution could be leave them in the laundry bag at least 72 hours and then wash as normal. If we cannot reach such a temperatures, or we cannot do the washing fast as possible, okay? Also, yes, obviously, professional laundry is always better, because they will have the equipment and the sanitizing agencies for doing these operations as well, okay? Wear your uniforms for work and not for doing other tasks. And as soon as it becomes contaminated, put it to wash. Do not shake the laundry. Avoid dispersing the virus. Okay. Also remind yourself, if you use a transport laundry bag, that has to be also washed and disinfected. But if you don't have such a laundry bag, put it in a waste bag and yes, in a close, keep it in a close waste bag until the minute that you can do the laundry. Okay, here are some of the products that you can use for industrial washing machines that have power of disinfections. For example, you have a link here that you can watch. Watch later. What's the recommended products that you can use for your washing machines that have effect against virus. For example, Lanadol evac work from 20, 30, 40 degrees temperature. It will give you the doses or whatever. Also, Otalin Peracet with peracetic acid that will have also a very good effect against viruses. So read the products that you're using and the recommended temperatures of use. And that will give you a guidance on how to perform the laundry of uniforms and tablecloth, anything that has become in contact with the guest or during service, for example. Serviettes, tablecloth, and things like that. Okay, waste. Yes, waste has to be placed into rubbish bag and whenever possible also in a second rubbish bag, well tied up. Waste bins have to have lids, okay, and be whenever possible worked with the pedal, not the touch the lid of the waste bins, okay. Yes, if you cannot dispose of the waste immediately, it can be stored up to 72 hours, and that it will make it more secure. Okay, but yes, during COVID also it is very important that you keep emptying the waste bins more often, so we don't have overflow of waste in the toilets, for example, or in the kitchens, or in a waste bin in the service area. So now more than ever, keep emptying these bins more often, okay? And if possible, put it in a second bag and tie up the bag, okay? Remind at the end of the day to clean and disinfect also the waste bins, okay? And clean your hands and disinfect your hands after you've done these operations as well, okay? But yes, rubbish has to be handled in a more efficient way and not let it piled up into the waste bins. And as possible, have lids and pedals to operate these waste bins. Okay, managing employee sickness. Employee sickness, okay. If anybody becomes unwell with a cough, fever, high temperature, or of any of these symptoms, they have to not go to work and communicate that they are showing these symptoms to take the steps that in the boat have been considered. That is the following steps: to go outside the boat in self-isolation, or to do a test to discard that you have, for example, the disease. Keep isolated until you know for sure that you have the disease or not, and keep yourself isolated from everybody and the rest of the crew. For example, if you are at sea and you cannot go in isolation elsewhere, okay? Yes. That will be following the rules that you have established on your own boats. But basically, when you show symptoms, do not work and do self-isolation until you determine if you have the disease or not, by means of testing or things like that. Yes, there will be there are guidances about what are the symptoms, and at the beginning of the presentation, you have a list of possible symptoms, no? Most common, a cough, continuous cough, and fever. Okay, but there are other symptoms as well, okay? Additional consideration. Yes, when the guests arrive, it will be recommended, when you are welcoming the guests, let's say they come in from a international flight. For example, now in Europe, Europe is open to other Schengen countries, not from third countries, but there are precautions during flying. People have to wear masks, keep social distance. They have to handle their bags on arrival individually. So there are precautions that they are in place in airports, for example. But when the guests arrive on our boat, we will show them our notice boards with the measures that we are currently taking, and we are going to offer hand washing stations where we're going to explain where they can have hand washing stations, and we are going to offer also sanitizer. Okay, so they could do the disinfection of the hands, cleaning and disinfection of the hands on arrival. Also, it is recommended as much as possible to keep the 2 meters apart crew from guests. Okay. And but as I said, every boat will have their precautionary measures displayed in notice boards, and that will be shown to the guests on arrival. Please, here are our precautionary measures, and here is our hand sanitizer, the hand washing, and we will try to keep 2 meters as much as possible. Okay. Also, when we are doing room services, we will try to leave the tray in the room and do this job in the short time possible to have the less contact possible. And we remind ourselves to work side to side, back to back, not facing the guests. So we will enter, leave the tray, and after, we will wash our hands and disinfect our hands. The same as well when we are removing the trays from the rooms. We will be as fast as possible. We will put all the cutlery and crockery away on the dishwasher to be cleaned and disinfected. And any linen will have to put into the laundry bag, not left lying around, not spread it and shake it. Okay? And wash your hands whenever you touch any of these items. Okay, housekeeping. Housekeeping, you have to consider the hand contact surfaces. What the guest could have touched that could have presence of virus. So we will remove, obviously, linen and towels to be put away for laundry into bags, not shaking it, and immediately going into the laundry. Then we will think what are the most contact points the guests could have touched. Bedside tables, remote control, taps in the toilets, flush handles, door handles, hair dryer handles, ironing board, safe buttons, wardrobe doors, minibar handle, kettle handle. That will be our main point of cleaning and disinfection after the guest has left the rooms, okay? And also, we said before, yes, every glass and crockery will be removed to be washed immediately. Bedding and liner bag can be washed. Protect yourself during the housekeeping using glove, disposable aprons, and even mask also. So please keep reading new government requirements and legislation regarding to COVID. Here are all the references where we based our webinar, mainly UK advice on the restaurants, bars, food service industry, but also UK hospitality industry. Here you have for references the guidance we use for doing this webinar. And now I will be open to any questions that you may have, if there are questions, but thank you for listening. I don't know if you have a lot of questions or it's simple, but I don't know, somebody can have questions maybe.
You did a great presentation. You've given us so much information that I think people are almost overwhelmed with all the information that you're getting. Let's see in the chat. Tatiana said it was a great session. She would like to have the recorded video. I think a lot of us would like to see the video back, because obviously to run through the sites. What I'll do quickly, guys, is I'll share an advice module and two PDFs that from Barcelona Crew Academy for you. It's coming into your chat now to give you a bit more information. The video will be on the website. Shall we add the presentation to the video, Nuria? Is that a good idea to have your presentation? So you can read it back?
Yes, no problem. But
It's the same in PDF, I think.
yes, the crew are familiar for food hygiene. Food hygiene is crew are familiar with it.
Of course.
It just increase the frequency and the social distance as much as possible. That's it. Social distance and increase the hygiene.
Well, we could have done the whole webinar in 1 minute then. Increase social distance and increase the frequency.
Just increase the hygiene and keep social distance.
Fantastic. That's it. Nuria, thank you so much for doing this. Everybody, I know a few of you had to leave because the time, we went a little bit over time, which is fine. Stephen says, excellent presentation. Thank you, Nuria. I think we all agree with those words. Very well done. A lot of useful information. I think a lot of people either got confirmation that they're doing the right thing, or got a few tips on how where they can improve. So for me, I think we're going to say bye-bye, and we're going to thank everybody again and hope to see you soon again. Emma, oh yeah, more compliments. Let's wait for the compliments. Thank you very much. Excellent presentation from Emma.
Bye-bye. Stay safe.
Bye.
Don't blush. Everybody, bye-bye. Thank you very much. See you soon. I'm gone in 5, 4, 3, 2, 1. Bye.
Bye from Barcelona. Bye-bye.
Bye-bye.